Hi, Alea Vas. You're welcome. So, for the rest of us who are live, can you just put your name on the chat? I hope I'm audible. I hope I'm audible. So if you can hear me, put it on the chat. Okay. All right. We'll soon. Oh, what's my name? Oh, I'll type my name now. Okay. Have you seen that? So that's my name. And I'm a gynecologist from Nigeria. So where are you joining from? I also want to know you. Okay. So where are you joining us from? Let me know you as well. Okay. We'll soon start very, very soon. We'll soon start. Oh, you are from Indonesia. Oh, you're welcome. All the way from Indonesia. So what's your occupation? Or what's your discipline? Are you also in the medical field? Are you also in the medical field? Okay. Or do you, or maybe you have someone around you with PCOS, because that's what we are discussing today. Polycystic Ovarian Syndrome. It affects a lot of women, and we have so much misinformation around it. So that's why today I decided to come up. Let me provide the correct information so that people will know what it's all about and be able to make informed decisions. Okay, you wrote something. I'm not able to understand that in English. Okay, maybe you write it in English so that let's be on the same page. Hmm? Let's be on the same page. Okay, I will just give the next 1 minute and we'll start. Hmm? Just 1 minute. So if you have any questions surrounding polycystic ovarian syndrome, just put it on the chat. I already have some questions here, so I'll just take the questions and run through the questions. But if along the line you have your own question, still, you just put it on the chat and I'll do well to answer your questions. So what I'm here to do today is to clear the air so that we understand ourselves better, understand PCOS better, so that if you have people around you with it, you can advise them better so that they don't take the wrong information, because we have a whole lot of wrong information out there. So I'm here to debunk the myths. I'm here to debunk the inaccuracies that possibly you may have come across online, on Facebook, on TikTok, on Instagram, even on YouTube. So let me reintroduce myself again. I'm Dr. Zoka C. Ezike, and I'm a gynecologist and obstetrician practicing in Abuja, Nigeria, and I'm also a public health scientist. At the same time, I'm a medical writer and medical reviewer, and I'm the team lead of the ACE Medical Consulting and Communication Services. So this is our official YouTube channel. So I'm bringing you this information through this channel. I'm also a member of the WHO FIDES network. This is a network of health influencers. So our aim, our goal within the FIDES network is to spread credible health information. And this month is PCOS Awareness Month. So that's why I want us to go through PCOS. It's better that you hear it from the experts. It's better you hear it from someone who knows, so that you'll be able to take informed decision. So we're starting right away. We'll start with the definition. Like I said, I already have some questions, but if you have any question, I'm looking at the chat. Just put it there for me to see, and I will answer as we go along. So the first question is, what is PCOS? What is PCOS? Most times that's what you see online, PCOS, PCOS. So what is it? Now, PCOS means Polycystic Ovarian Syndrome. Now, ovarian means that it's from the ovary. The ovary is that part of the woman that produces the eggs. That's the ovary. Now, polycystic means that it has multiple cysts. The ovary has multiple cysts. And a cyst is something like a sac, a balloon that is filled with water. So sometimes you find it in the ovary, maybe one or two, but occasionally you find some people having it in multiples. And people with polycystic ovarian syndrome, they have it in multiple. That's why it's called polycystic. Poly means many. Then cystic, cyst. Then it's also called a syndrome because it's a collection of so many symptoms. So it's not like a straightforward disease. There are so many things associated with it. So that's why we call it a syndrome. So that's the layman's description of what polycystic ovarian syndrome is. Now, it's a hormonal disorder in that it affects the hormone of women. So women with polycystic ovarian syndrome, they normally produce more male hormones than normal. Now, every woman produces some level of male hormones. Every woman does that. But then for those with polycystic ovarian syndrome, their ovaries produce more male hormones than the rest of us. And then they also have a high level of insulin resistance. We all have insulin in our bodies. Insulin, the hormone, is the hormone that regulates blood sugar. But for those with polycystic ovarian syndrome, they have a high rate of insulin resistance. So their body doesn't respond to insulin as it should. And because of this, they have a whole lot of symptoms associated with problems with their menstruation, sometimes problems with how they look. We'll talk about this in details. Now, problems with even fertility as per conception, getting pregnant. And you also have some long-term complications of PCOS. So PCOS is not just something that just happens and goes. It's a lifelong challenge. It's a lifelong disease. So what exactly causes PCOS? That's the question that we need to answer, because some people will be wondering, how did I get this? Or maybe did I contract it? Maybe the way people contract HIV and hepatitis. No. PCOS is a genetic disease, it's an inborn disease. So what it means that whoever that has PCOS actually was born that way. So that's within the person's genetic makeup, the way God made that person. Now, this usually runs in families. So what it means is that if you have PCOS, there's a likelihood that there may be other people in the family also with PCOS. And those with PCOS usually have high level of resistance to insulin. And that's why sometimes they start manifesting symptoms of diabetes along the line, because that's also the challenge you have with diabetes. People with diabetes, especially type 2 diabetes, they don't respond to insulin, and because of that, they have excess sugar than every other person. So, because the ovaries produce more male hormones than female hormones, so they have this imbalance in hormones that now affects every other thing like the menstruation, fertility, ovulation. Ovulation is the production of eggs from the ovary. So because they have higher male hormones, they don't usually ovulate every time, and because of that, their menses is also not as regular as it should be. So if you are just joining us, you can put in your questions on the chat. I already have some questions here that I'm going through, so I'll be just going through the questions one by one as you understand PCOS best. If you have your own question, just put it on the chat. I'll be glad to answer it. I'll be glad to clear the air on this. Now, how common is PCOS? PCOS is quite common, about 1 in 10 women within the reproductive age group. Now, in the reproductive age group, there are those between the ages of 15 and 45. So you have up to 1 in 10 women. That's about 10% of women with PCOS. So that will tell you that this is actually something that is common. So if you have the symptoms of PCOS, or if you've been told that you have PCOS, know that you are not alone. You have other people also going through this same challenge with you. Now, what are the symptoms of PCOS? That's the next question that we'll look at. What are the symptoms of PCOS? One, like I said, PCOS, people are usually born with that. Then over time, it starts manifesting. By the time they start seeing it, their menses. For most people, the most obvious sign is usually irregular menses. So if you are that kind of person that maybe your menses will come this month, then to skip another month, or sometimes may even skip up to 2 months before it comes again, that may be a sign that you have PCOS, but it's not conclusive anyway. But if you have that, that may be a sign that you may have PCOS. Another thing is that people with PCOS also have excess hairs. They grow hairs like men, so sometimes you can find hairs on their chin. Sometimes they have hairs on their chest, on their tummy. And now that you have excess hair doesn't completely mean that you have PCOS, but that may also be a sign of PCOS. Another challenge that they also have is challenge of weight gain. So most times they find it difficult to lose weight. So they may be overweight or obese. You know the way we determine who is overweight and who is obese. We use the body mass index for that. Body mass index for that. Now, the body mass index is your weight in kilograms divided by your height in meters squared. So assuming your weight is 60 kg and your height is 1.6 meters, your body mass index is that 60 kg divided by 1.6 multiplied by 1.6. So when you now get the BMI, the normal BMI is between 18.5 to 24.9 kilogram per meter squared. That's what we consider as normal. If you are below 18.5, you are considered as underweight. If you are between 25 to 29.9, you are considered as overweight. Then if you are from 30 and above, you are considered to be obese. Now, most people with PCOS usually have problems with their weight, so they are either overweight or obese. But once in a while, you still find people with PCOS that are not overweight, that they have normal weight. So this also is not always a problem. Then they also have a challenge of acne, what we call pimples. And this is because of the high level of male hormones that they have. So those male hormones makes the skin to be very oily, and that's what clogs up the pores on the skin, and that's why they usually develop acne. Then also the problem of difficulty in conceiving. So when they finally plan to conceive, they may have problems. That doesn't mean that the problems must be there, but they may have problems with conceiving. It doesn't happen in everybody. If you are just joining us, let's know where you are joining us from. And if you have any question, I can see Dr. Anya Chevrolet. You're welcome. If you have any question, you drop it for us. And when we are done, you can still go back to watch from the beginning, because I've actually taken about 2 questions so far. So I have a list of questions that I'm running through. So, and my intention is to clear the air on issues surrounding polycystic ovarian syndrome, because I've seen a whole lot of misconceptions. I've seen someone with severe abdominal pain, chronic abdominal pain, that actually termed her problem PCOS. In fact, that was the reason why I decided to do this, because PCOS doesn't cause chronic abdominal pain. So sometimes you see people with other issues terming it PCOS. PCOS is basically a hormonal problem. But then, because hormones affect almost all the parts of the body, it can affect any other part of the body and manifest in so many ways. And that's what I'm trying to tell us. I've discussed irregular periods. There are even some persons with PCOS. What is the role of inositol and hyponoid for treatment of PCOS? Do we do serum or to know if they have hyperandrogenism? Okay. Let me just finish what I'm saying. I'll answer the question. So apart from the acne, the irregular periods because of the ovulation, the problems with weight gain, they also have this thing that we call acanthosis nigricans. Sometimes they have dark patches, maybe around their armpits, sometimes even on the face. And it's not only people with PCOS that have that, people with diabetes and those with obesity. So it's just because of that insulin resistance. That's why you have those dark patches. We call them acanthosis nigricans. Okay, now I'm coming to the question so that I don't lose. I know there are so many newer methods that are coming up. I know that recently I saw this study on the role of inositol, but it's not yet widespread. It's not yet widely used. So basically, we still use some of the common hormonal medications or surgery if need be, and of course, lifestyle management, lifestyle modification. Then concerning serum testosterone or DHEA, usually we prefer serum testosterone, because although we also check, because when you have a patient with PCOS, there are other diseases that may look like it's something like Cushing's syndrome or other problems coming from the adrenal gland. And some persons may even have androgen producing tumors. That's other tumors that produce male hormones. So some of these diseases, they mimic PCOS. So for PCOS, we prefer to do the testosterone level. But if you not think that there may be a possibility that this is coming from another organ, maybe the adrenal gland. Now, the adrenal gland is a tiny organ that is on top of the kidneys, but it's very important. It produces a lot of hormones, some of them male hormones. So now, if the male hormone is coming from that adrenal gland, DHEA will be raised. But if it's PCOS, then testosterone may be raised, not always raised, not always, but there's a chance that it may be higher than normal. So I hope I've answered your question. Okay, so let's continue. Now, apart from all the symptoms, in fact, there's this acronym we normally use. We call it OHIO. O means oligomenorrhea. Oligomenorrhea means irregular menses or irregular ovulation. Some people say oligo-ovulation or oligomenorrhea. That's O. H means hirsutism. Hirsutism is excessive growth of male pattern hair, not just excessive growth of hair. That's H. I means infertility, like I mentioned, because they don't ovulate always, they have problem with infertility. Then O means obesity. You can also call it overweight anyway, because some of them may not be obese. Then they also have problems with alopecia. That's the thinning of hair, especially frontal hair. So sometimes you see their hair receding like what you have in men. Now, all these symptoms, there are other diseases that may cause some of these symptoms, so not just PCOS, and that's why you need to be evaluated. I also want to add that whatever we are doing here is not a replacement for consultation at the hospital. What I'm just trying to do is to provide correct and factual information. So if you have any challenges with PCOS, you should also try to go and see your gynecologist. This does not replace that consultation. I just want to provide some information. Now, how is PCOS diagnosed? I've talked about the symptoms. There is not enough to just look at somebody and say, okay, because your menses is not regular, because you have hair that looks like that of men, you have PCOS. We have to do a test. And there is something we call Rotterdam criteria. That's what we use to diagnose PCOS. Now, in that criteria, you have 3 components. And that one of the components means that you have to prove that the person has irregular menses or that the person is not ovulating. So we call that oligomenorrhea or oligo-ovulation. You have to prove that that is happening. That is one. The second criteria is that you have to prove that the person has high level of male hormones. Either that you prove it through the symptoms you are seeing, maybe excessive growth of hair, or you prove it through test results. So that's one. So it's either you call it clinical or lab evidence of hyperandrogenism. So you are proving through what you can see or what the lab has shown that this person has high level of male hormones. That's the second criteria. Then the third criteria is that you have to do a scan. And the scan is not the normal scan you do through the tummy. No, it's a scan that is done through the vagina. We call it transvaginal scan. So you have to do a scan that shows that this person has multiple cysts, more than 12 in at least one ovary, measuring between 2 to 9 millimeters. Remember when we started, I tried to describe what, or rather to explain what polycystic ovary means. Poly means multiple, cystic means multiple cysts then on the ovary. So you have to prove that this person has multiple cysts of more than 12, measuring between 2 to 9 millimeters. Now, what happens is that because they have high level of male hormones, the ovary doesn't behave the way it should behave. Usually in a woman, every month, the ovary, we call it recruitment, because a woman is born with all the eggs that she will ever produce in life. She's born with that, unlike men that they continue to produce sperm. No, for women, the woman is born with everything at birth. Now, every month, the body recruits, we call it recruitment, recruits maybe about 15 of those eggs and starts developing them so that they will now mature and become the mature egg, we call it follicle, that will now ovulate. What happens is that in normal persons, in men, not normal, PCOS persons are still normal, please pardon that. In people without PCOS, this process happens seamlessly. So at the end of the day, you may have about 1 or 2 mature eggs that will now ovulate. Then people with PCOS, their body will recruit about 15 or even more, but none of them will get to that maturity stage. So some of them will get arrested at some point, and that's why they have multiple cysts. So they get arrested and just remain there as cysts on the ovary. So that's what you see when we do transvaginal scan. So now how you use this Rotterdam criteria is that you have to get at least 2 out of 3 of these 3 things that I mentioned. Remember the things I mentioned: irregular periods or irregular ovulation, clinical evidence or lab evidence that there is high level of androgen, that's male hormones, then ultrasound evidence. So you have to get 2 out of these 3 to be able to say that this person has PCOS. So it's not enough for you to just do a scan and you see ovaries with multiple cysts and you say this PCOS. No. So you have to check all these things, and that's why you need to visit a gynecologist, someone that knows, so that they don't misdiagnose you. So this is how we use this Rotterdam criteria to diagnose PCOS. Now, if you have abdominal pain or some other things, and there may be due to other issues. There are so many women issues, not necessarily PCOS. Like I mentioned, this is the major reason why I decided to do this, so that people will stop attributing things that are not PCOS to PCOS. PCOS doesn't cause abdominal pain on a normal day. It doesn't. It just affects the way your ovary works. That's the basic thing. Okay, so the next question. Now, how can we manage if you have problems with PCOS? How can we manage it? Now, the way we manage people with PCOS depends on what is their problem. You may have a young lady, maybe a 20-year-old lady that is not yet married, is not trying to conceive, and her major issue is that she's not having regular menses, and she wants it to be regular so that she will feel like a normal woman. So for that person, you just try as much as possible to get the menses to be regular. You may have another person that the person's major problem is the acne, the pimples that she has, or maybe the excessive growth of hair on the face, and she wants that removed. Then you manage that person also according to that. Then you may have a woman, maybe a 30-year-old woman, married for 3 years, yet to conceive, and her that she wants to conceive. Then you manage that person also. Now all these things, the management are not the same. Like if you're trying to manage someone maybe with hormonal drugs to see for the person to see their menses, sometimes some of these hormonal drugs may not allow the person to get pregnant. So you have to know exactly. That's what you normally do. When you come with PCOS to the hospital, we'll ask you, what exactly do you want at this moment? You want your menses to be regular, or you want to lose weight, or for the pimples to stop, or you want to get pregnant. So whichever one you say is your problem, that's how we manage it. Now let's assume that this person came just to manage the menstrual problems, the problems with menstruation. Now, whether you have this, or you have obesity, or you have infertility, one thing that is very important in the management of PCOS is weight loss and exercise. So, and you know, they usually go together. So, and by the time you talk of weight loss and exercise, the next thing that you talk about is diet. So this is what we call lifestyle modification. Now, evidence has shown that if you have PCOS and you lose up to 5 to 10% of your body weight, that alone may make the ovaries to start functioning well. So you may not even need any medication. And that's why people need to know this on time, because sometimes you have ladies that will have PCOS and they won't know they have it, and they won't bother to manage their lifestyle until maybe years later when they finally get married, they now finally find out that this is what it is. So that's why you need to, once you have any of these symptoms, even if you are 19, try and see your gynecologist early so that you start the lifestyle modification on time before you are even ready to conceive. So lifestyle changes is what we usually advise anybody, no matter your concern about PCOS. Then if this thing doesn't work, sometimes we also use hormones. Now, I won't want to mention the doses of hormones, so that, like I said, this is not a hospital. I'm just trying to tell you how it's managed. So some hormones may be used to make your menses to become regular. Or sometimes if we can't get them to be regular, at least we can give you hormones that may make you to bleed at intervals, maybe every 3 months. The important thing is that why this should be done is that the lining of the womb, the way God made it, is that every month it thickens, and after thickening, it sheds. That's what we call menstruation, when that lining sheds. Now, this is a natural process that should happen. So if for any reason it doesn't happen and that lining continues to build up over time, it may lead to what we call endometrial hyperplasia. That's when it gets over-thickened. And if that is left, the endometrial hyperplasia, if that is left for some time, it may end up, it may end up, if that is not handled, may end up leading to endometrial cancer, that's cancer of the womb. So don't just say that you are not seeing your menses, that you don't have any problem with that. If you've not been seeing your menses regularly, then you have to go to the hospital, because that lining, it has to be shed. If it continues to get thickened, it may become a problem for you later in life. So we can use hormones for that. I won't mention the hormones, so but just know that you can either use exercise, diet, and exercise and weight loss, and you can also use hormones. Even when we use hormones, we still advise you to lose weight, because if you don't lose weight and you are placed on hormones, the hormones may not really work the way they should. So even as you are taking the medications, weight loss is still important. I've discussed what BMI is. So you have to maintain your BMI, body mass index, between 18.5 to 24.9. 18.5 to 24.9. I hope we are together. Okay, so let's continue. So if you're just joining us, you can put in your questions so that I'll answer it as we go along. Now, if your problem is the excessive hair, or you have acne or hair loss, now those ones can be managed in so many ways. In addition to weight loss, and exercise, those ones are very important. Now, let me tell us about exercise. Even if your weight is normal, it's between 18.5 to 24.9, and you have PCOS, you still need exercise. Why? When I was discussing the causes, I mentioned insulin resistance. That even though they have insulin, but it doesn't work the way it should. Now, whether your weight is, your BMI is 20 or your BMI is 30, exercise helps the body insulin, that's the insulin in your body, to work. So even if you have normal weight, for the sake of making that insulin to work better, you still need the exercise. If the body doesn't respond to insulin very well, your ovaries will start shutting down. Not really shutting down, it will start malfunctioning. So, or it will get worse, because usually in PCOS, people with PCOS, the ovaries malfunction. But with insulin resistance, the higher it is, the more malfunction. So that's why you need exercise. Now, if your problem is excessive hair growth or all these cosmetic issues, usually as gynecologists, sometimes we don't manage that on our own. But we can also manage it sometimes by placing you on some hormonal drugs, which can help. Combine oral contraceptives can help to reduce the androgen level, the male hormone level. But if it gets worse than that and you need more treatment, we can refer you to dermatologists. Sometimes they have creams that can help. They can do waxing or other procedures that may help to reduce the excessive weight loss. Now, this is quite important. We've seen some people with PCOS that develop mental health disorders because of their skin problems. So we shouldn't just wave it. Maybe if you have someone around you and the person is complaining, and I'm not trying to say that everybody with excessive pimples or acne, that they have PCOS, but if they have that and they also have other things suggestive of PCOS, you may need to advise them to go to the hospital. Because right now we are having a whole lot of people developing mental health challenges, especially women. So that's why we need to pay attention. Now, can PCOS affect fertility? Very well, it can. Because the basic thing that happens is that the ovaries do not ovulate every month. It's maybe once in a while, sometimes maybe once in 6 months or once every 2 months, or maybe once in a year. But this is not how God has made it. Ovulation is supposed to occur every month. And this is the major challenge with PCOS when it comes to infertility. Because if a woman cannot produce the egg, then even if the sperm is available, it won't have any egg to ovulate. And most times, what happens, especially for those of us in this part of the world, Africa, most people, they don't usually know that they have PCOS. It's when they finally get married and they can't get pregnant. Then when they come to hospital and you start asking questions, they'll tell you that for the past 10 years, they used to menstruate every 5 to 6 times a year. And they never saw it as anything wrong. So that's why you need to share this information. And if you're on this stream, you can still share the live stream. Let people know better that these are not normal things that people should just. Now, how is infertility in PCOS treated? Now I'll have to go back to lifestyle modification again. That's usually the first thing. When I have a patient with PCOS, that's usually the first thing I tell them. Say, go and exercise, watch your diet, try and lose weight. There are some of them that with that, the ovaries will start working, they'll start ovulating, they'll get pregnant. So we're not saying that if you have PCOS that you cannot get pregnant. No. We have so many people with PCOS that didn't even have to need any form of medication. Some people, so you can actually get pregnant with PCOS without going through medications or surgery. It is possible. But we've also seen cases where with the lifestyle modification, it didn't work. So you have to step up higher. So it's usually something that you go from one level to the other. So first of all, we start with the exercises, encouraging the person to lose weight. But if that doesn't happen, then you go to the next step. The next step is to try to make that ovary to ovulate. And how do you do that? You give drugs. There are so many drugs we give. These are not drugs you should take on your own. It's just an advice that I'm giving, not for you to go and purchase the drugs. So we can give a whole lot of drugs, clomiphene citrate, letrozole. Sometimes we can, these ones are tablets. We can even go up to injections, HMG and all those. So, but it's for your doctor to determine which drug to give and how to upgrade to the next level and when to upgrade. Now, just go to the stores, to the pharmacy shops to buy these medications, especially if you are in a country where there are not prescription drugs, because there is a limit to the number of times that you can take these drugs. Some of them, there are some of them that you cannot take more than 6 times in your lifetime. So if you waste it on your own, maybe you just go and buy it and you take it without any form of monitoring, and it just gets wasted. When you come to the doctor and the doctor counts, maybe you've taken it up to 4 times on your own, then that what it means is maybe not need twice for you to take it in your lifetime. And what that means is that after that, the doctor will have to upgrade to another. And usually the higher you go, the more costly it becomes. By the time you move from tablets to injection, the cost will start going up. So please don't take these drugs on your own. Sometimes we also use drugs used to treat hypertension, diabetes, drugs like metformin. Like I said, there is a link between, can we use the GLP? Well, I don't think Wegovy is in Nigeria yet, but I know in some countries, I think in the US, it's licensed for use for weight loss. So you can use, some people may even go up to the extent of doing bariatric surgery if that is needed for them to lose weight. So Wegovy is not, as at the last time I checked, I think that was last year, it wasn't yet in Nigeria, but it may be in some other countries. I think it's in US, it's approved for that, it's FDA approved for that reason, for weight loss. So if you have it in your country, why not? You can take it, but don't rely on, start with lifestyle modification before going up, taking drugs or even thinking of bariatric surgery. Now, like I was saying, we can use drugs like metformin. These are drugs used for treating diabetes. They can also be used, they may help the ovaries to ovulate. But if these drugs they don't work, then there may be need to upgrade to the injections. So now your doctor will have to determine whether there should be an upgrade. And sometimes, if the injections don't work, there may be need to do a surgery on the ovary. We call it laparoscopic ovarian drilling. And this is usually done, laparoscopy is a form of pinhole surgery in which tiny instruments are inserted into your abdomen, into your tummy through tiny holes. So through that, electricity will now be used to drill holes on the ovaries. Why this is done, usually done, is because in people with PCOS, their ovaries have very thick capsule. The covering of the ovary is very thick because of the high male hormones they have. And because of that thick covering, they find it difficult to ovulate. So not only the covering, there's something we call the cortex. That's the inner part of the ovary. It's also very dense. So what this drilling does is to create holes both on the capsule and on the cortex. And sometimes by doing that, they will start ovulating. So that's another form of treatment. So when this is done, it's done with the hope that the person ovulates naturally, then you won't need IVF. But in some cases, the exercise may fail, the weight loss may fail, the oral drugs may also fail, the surgery may fail, and the only thing remaining may be to do an IVF, in which case you are given injections that will make you to ovulate. But they are very high profile injections, and in some cases, if when you are giving the injection it doesn't work, there may be need to maybe get the egg from another person. That's what we call third-party IVF. Then fertilize it with your husband's sperm for that to happen. So you see that the management goes from one level to the other. And that's why you need to see a specialist so that you'll be given the right treatment. Now, what are the complications of PCOS if left untreated? This is quite important. Why? Most people with PCOS, their major intention is usually to see their menses and get pregnant. And once they end up achieving pregnancy, they forget about the PCOS. Now, this shouldn't be. Why? Because even though PCOS happens during the reproductive age group, I've mentioned what reproductive age group means, between 15 to 45, some people say 49. The effect sometimes may go beyond age 49. So, like I mentioned when we started, it's a genetic thing. So what it means that you are born with it, so it doesn't have cure. It can only be managed. So when we manage people with PCOS, we usually look at the long-term complications as we manage them. Now, one of those long-term complications is the risk of having diabetes, the type we call type 2 diabetes. Now, what happens in type 2 diabetes is that even though they have insulin, they have excess insulin, but they don't respond to the insulin. So that's why they still have excess sugar in the blood. And people with PCOS, they usually have this risk of developing type 2 diabetes later in life. So even if you have PCOS and you end up delivering all your children, you still need to remember this. And that's why you need to be checking your sugar at least every 6 months and continue the lifestyle modification, the dieting, the exercises beyond pregnancies, beyond having children. You have to continue this so that at least it may delay it, even if it comes later, at least it may not come, let it not come so early. In some occasions, with those lifestyle modifications, it may even prevent it from coming at all. I'm talking of diabetes from coming at all. Now, the long-term risk is not just type 2 diabetes. The other things associated with type 2 diabetes, we call them metabolic syndrome. Diseases like hypertension, high cholesterol in the body, obesity, we call all these things, in addition to type 2 diabetes, we call all of them metabolic syndrome. So people with PCOS are at high risk of having metabolic syndrome. So what it means is that throughout your life, if you've ever been diagnosed of having PCOS, throughout your life, you have to be checking your sugar often and on. You have to be checking your blood pressure, your cholesterol level. You have to be careful about all these things. Then you have to continue your lifestyle modification for life. And the best way to do lifestyle modification is for you to start it yourself, not maybe when you finally develop the disease and your doctor now prescribes it for you. It then becomes a prescription. So you can decide on your own to start modifying your diet, avoid refined sugars, avoid high carbohydrate diets, make sure you have a lot of veggies. Go closer to nature. Make it your habit. Don't allow the doctor to even prescribe it for you so that it becomes easy for you to do. So these are some of the complications. Then some people with PCOS also have problems with sleep, especially if they're obese. So they may have, we call it sleep apnea. How many times can we induce ovulation for PCOS before considering IVF? Now, for most people, we don't like using either clomiphene citrate or letrozole for more than 6 cycles. Now, the reason, let me say so that we understand. The reason is that there is this link that is not yet verified anyway, but scientists believe that there's a link between excessive use of ovulation induction drugs and cancer of the ovary. So the link is not yet fully established, but it's better to err on the side of caution. And that's why once we give it 6 times, knowing that after that 6 times, the person may still go ahead to do IVF and receive other multiple injections again. So it's safer that once you try the tablets for 6 times, then you go up so that you don't get exposed to the tablets for a very long time. And that's why you shouldn't just go to the pharmacy shop to buy it on your own. Because when a doctor gives you the drug, usually we monitor, sometimes we even do scan, we call it follicular tracking, to know how the eggs are developing. Then you'll be advised on when to meet with your husband, or they may even try to help, like doing something that we call intrauterine insemination. So to inject the sperm, sometimes these things help, because it's better when you give the medication, it's better you achieve pregnancy with it so that it doesn't get, because once you waste that, then that one is off. You start counting down. So please, that's why you shouldn't take it away. So some people say 6 times. It's not based on science anyway, but that's the general practice. We don't usually give it more than 6 times. Okay, so, I was talking about the long-term risk. I mentioned sleep apnea. Some of them, especially those with obesity, they have problems with sleeping. So sleep apnea is, and you may have noticed if you have people like that around you, that maybe 1 minute they're snoring, then the next minute they will stop breathing completely. Usually happens at night. Now, this can happen in people with PCOS. They'll just lose their breath at night, then they'll catch it again, and will continue, and it continues like that. Then they also have problems with mental health issues. I've mentioned it before, that's why you shouldn't ignore maybe that 19-year-old with excessive pimples or excessive hair growth that is complaining. You shouldn't ignore some of these things, because we know that 1 out of 100 deaths currently that are due to suicide, and suicide is usually linked most times to mental health disorders. So that's why we shouldn't. So people with PCOS are also at risk of that. And if for any reason they eventually develop infertility, it even gets worse. So we should also look out for that if we have them around us. Then we have the risk of endometrial cancer. That's cancer of the womb. Because this lining of the womb keeps building up, unlike those without PCOS where they shed it every month, that build up may eventually lead to the risk of endometrial cancer. I'm not saying that it happens in everybody, but it's just for anybody with PCOS to know that this is a possibility. And that's why your interest shouldn't just be to get pregnant. You should also be interested in making sure that menses is regular. And that's why you should also visit your doctor early enough in life so that they'll start regulating it on time before you even get ready to get married. Now, Is PCOS curable? I've already answered that. It's not curable, but it can be managed. It's a genetic disease and it's not your fault. You just happen to be born with that, like so many, or like I said, 1 in 10 women. That's 10% of women in their reproductive age group. So you're not alone. It's not curable, but it can be managed. What lifestyle changes help in managing PCOS? I've mentioned that, so I'm just repeating. Balanced diet, regular physical activity. Let me talk about exercise. Sometimes we think that for you to exercise, you have to maybe register at a gym or maybe have a gym in your house or have an instructor. These things are very good if you can afford them. But within your house, you can exercise. In fact, when you go on YouTube, there are so many exercise videos, 20 minutes, 15 minutes, 30 minutes. You can just download them. And if you can get the gadgets that will help you to time, you don't even need to leave your house to exercise. And what WHO recommends is 150 minutes of moderate exercise per week. So that's about 20-something minutes per day, which you can achieve on your own. And if you have the money to upgrade, to register at a gym or to get a gym yourself, no problem, you can do that. But that shouldn't limit you from exercising. So I've talked about that. Then stress management, we know that PCOS on its own is stressful. It's a stressor. So you should also, and when you are stressed, when we are stressed, the body produces a whole lot of hormones. We call them counter-regulatory hormones, like cortisol, adrenaline. And some of these hormones, like cortisol, will even make you to add weight more. And sometimes you see some people eating more because of stress, so making them to add weight. If you check our channel, we have a video on 7 steps to lose weight. I would advise you to check that video and watch it. So you see that stress management is one way of losing weight. So you like mindfulness, breathing techniques, yoga if you can, and any form of relaxation techniques, and even listening to music, soothing music. These are ways to relieve stress and trying as much as possible to maintain a healthy weight. So you can see that whether your problem is the cosmetic problem or problem with menses, problem with infertility, lifestyle modification is central to the management of infertility. There are so many innovations coming up, like some of the questions we saw in hospital, yes, but these ones may not be within your control where you are in your own locality, but lifestyle modification is within your control. So whether you even have PCOS or you don't have, is something that all of us should do. Manage your diet, exercise, maintain your weight, and you see that you may even have PCOS and not know. And I believe there's some women with PCOS that don't know. Probably they started all this lifestyle modification on time and it never manifested. So they won't even know that they ever had PCOS. So PCOS is not the end of your dreams. It's not your fault. Know that. You didn't contract it. It's not because of your lifestyle. You were born that way. And it's not the end of life. It's also not the end of your fertility journey. It's manageable. You can still get pregnant. You can still live your life to the full once you do the things you're supposed to do. So I believe this session has helped us to learn, and we can also always come back to watch the recording. And I think from now on, maybe once in a while, we'll have to do this because we'll have so many misconceptions. And that's why health care practitioners should come up to do some of these things to let the people know the right information. So thanks for joining Anya Chebel. Dr. Anya Chebel, thanks for being here, and any other person who is okay. I think Alia has gone, and for those of you that will still watch the recording later, just learn and make sure you share and let people learn as well. So see you next time. See you.